So if we look at our patients with Crohn's disease, approximately 60 to 65% of them are going to require an operation at some point in their lives. So surgery is still very much part of the armamentarium for clinicians treating IBD. It is always a question of timing. And not delaying surgery unnecessarily, but equally, making sure the patient has had the opportunity to explore all their other options before going for surgery, if that's what they want to do. With ulcerative colitis, still about 25% of our UC patients will require colectomy at some point in their lifetimes. So surgery, again, very much still part of what we do for patients with inflammatory bowel disease. And really, where the magic happens is in sort of the interface between medical gastroenterologists and surgeons. Having a good IBD team, a good IBD MDT, radiologists and pathologists who are interested in inflammatory bowel disease, and good IBD nurse specialists, and building partnerships with primary care. So fecal transplant is a very interesting area of research. The research that we have to date seems to make a distinction between patients with Crohn's disease, in which fecal transplantation has performed poorly, versus ulcerative colitis, where it has shown a little bit more promise, again probably due to the reason that the inflammation in ulcerative colitis is relatively superficial, so anything that changes the composition of the lumen may well help. There was a very interesting study done in Canada which was initially stopped for non-effect but then subsequently reopened, where it was noted that patients who received stool from a particular donor were getting into remission, whereas patients who were getting into it from getting donor stool from other donors were not getting the same effect. And it makes sense really when you think of it. If we think of any other form of transplantation in medicine, there is some sort of a matching process between donor and recipient, and why wouldn't it be the same for fecal transplantation? So although it's become very well established for conditions such as C. diff now, the role in inflammatory bowel disease is still evolving, but certainly very much watch this space at the moment, I think.